Hi, good morning from Montreal. It's Gerald Major here, reporting from hashtag C Arthritis, reporting from the 2019 Canadian Rheumatology Association and Allied Health Professionals annual scientific meeting. And I'm here with Dr. Claire LeBlanc.
Yes.
And so what I'm going to do is give you the opportunity to tell our viewers who you are and how you end up in rheumatology.
Sounds great. So actually, I went about my career a little bit different than many of my colleagues. I started off as a pediatrician, and I got totally interested in sport medicine and became specialized in that, and then became an academic pediatrician and fell in love with rheumatology. So I went to Toronto, did my training, and now I'm board certified in both pediatric rheumatology and sport medicine.
Excellent. That's a pretty unique combination.
It is a unique
How,
combination.
how
Yes.
often does sport and rheumatology kind of combine?
I think what's unique about my specialty is that I get the benefit of being able to identify inflammatory conditions when I'm doing my sport medicine
Right.
office, and I can identify more mechanical conditions when I'm doing my rheumatology. And I feel like I can impart treatment in both. So I feel very blessed.
There's something to so I live with ankylosing spondylitis and psoriatic arthritis, and coincidentally, a lot of the patients that I speak to seem to have been involved in athletics at a young age, I mean, including myself. So you must see kind of, like you're saying, you can see this in that, but
Absolutely.
what's the connection to, is there a connection to arthritis and athletics?
Well, I think if you're going to look at it from a useful preventive medicine side of things, I think that anybody affected with arthritis, once the time is right and the rheumatologist deems it appropriate, staying physically active for your entire life is extremely important. It reduces the risk of obesity and diseases that are related to that, and gives you a better quality of life. So I think it's a good thing to be physically active, being involved in sport, even if you have a diagnosis of arthritis.
Right. It in fact is my best medicine,
Yes.
and I take several, but I can only be at my best when my exercise is there, because usually when my exercise is there, then my appetite is there, my nutrition then follows. So speak about just, it's something that we say a lot in arthritis about exercise, and sometimes you say things so many times that you just don't end up listening to that. So a little bit more about what you see on exercise contributing to really chronic disease in general.
Or contributing to the treatment of.
Right.
Yeah, I think that what I basically indicate to my patients, and my patients are children and adolescents, but it's amazing. I guess to give you an example, when I have kids in my office and I make a diagnosis of juvenile arthritis for the first time, many of these kids have been active, especially the juveniles, and you say to them, you have a diagnosis of arthritis, and their jaw drops, and the parents are starting to get upset, and they think the life of this child or this adolescent as an athlete is over. And that's totally wrong. And our goal now, when we treat kids with arthritis, is to get them back to the level that they were before so that they don't even miss a step. It's true, it may require medication, but guess what? They get back on their feet and they get right back to it. So to me, quality of life is so important, and exercise and physical activity is part of that.
It's really nice to see the funding that's gone into pediatrics now, and I think this is probably my fourth pediatric interview.
Oh, okay.
So I mean, I'm learning a lot, and what I'm learning is that that we're not making the same mistakes in pediatrics, and we're actually learning from our children very much so. It was interesting that you say, because overall, from an arthritis perspective, we're kind of known as the invisible disease, although we count for most of the workplace absenteeism. People with arthritis in their adulthood, specifically osteoarthritis, feel that it's just a condition with getting older, and they'll just live with it. So it's funny that you mention, not funny, but interesting that you mention parents, when they hear of this diagnosis for their children, will think that their life is over. Yet, adults living with osteoarthritis, maybe because of, I mean, think of all the athletes out there with osteoarthritis these days, and they are just accepting it and living. And I mean, it doesn't have to be like that. So.
And I think also when you talk about living with arthritis as an adult, you can make a decision. You know, let's say you have a diagnosis of osteoarthritis, for example. You can decide, well, there's nothing I can do, and I'm going to have to just live with what I have. Or you can say, I want to do better, and I want to stay active, and I'm going to do everything I can to maintain my physical activity level. And I think keeping a positive attitude and staying active is so important.
Well, my diagnosis of ankylosing spondylitis at 21 technically was a lifelong exercise prescription.
True.
So you have a presentation coming up. It's called Snap, Crackle, Pop. So let's hear about what that's all about.
Well, you know, the theme of this particular conference is building bridges. And what I'm able to do in my sport medicine practice is I have the wonderful opportunity to work with a team of physiotherapists and other allied health professionals that really help me help my patients do so much better. So what we're doing in our workshop is we're presenting a few case stories and demonstrating how physiotherapists and sport medicine doctors or rheumatologists can work together to make a better outcome in these particular cases. And we're also focusing a little bit on whether or not bracing is indicated. And so those that come into our workshop are going to get a chance to feel, touch, maybe even try on a brace or two.
Oh, that's really cool. So you mentioned about building bridges in this year's theme. What is it about the CRA this week and or AHPA that you found most interesting so far?
Oh, it's hard to sort of identify one thing because there were so many wonderful things that I really enjoyed about this particular conference. But if I had to sort of say what I liked the best, was the opportunity for me to talk equally among my peers, my rheumatology peers, and my allied health professional peers. And our particular poster that we presented is not specifically on sport medicine, but I was so excited to see the people who came to my poster were not just rheumatologists, not just pediatric rheumatologists, but allied health professionals too. So I think that's what I enjoyed the most.
The Allied Health Professionals Association's pre-course on, I believe it was Wednesday. So that was fantastic. And I mean, I've just recently been exposed to really the power of that organization. You know, it's another level, right? So we talk about rheumatology and we talk about allied health and the models of care and how they kind of incorporate all this stuff in. So my next question would be to you is around the patients. What have you seen from patients this week at the CRA that maybe you haven't seen before?
Well, as it turns out, our particular poster had to do with the, let's just say maybe pilot testing of a series of patient tools that we created. And these are YouTube videos, just little 1-minute videos to help children do their home exercise program that was prescribed by their physiotherapist or their occupational therapist at home. And we were so delighted to have patients come to our poster and say, wow, how can we access these videos? So we're in the process of rolling them out, and we will be able to have accessibility, if you will, through a website at the Children's Hospital, and we're looking so forward to sharing the tools that we've created.
Is that tool something that Nicole Johnson is involved in, or at all, or is she aware?
She is, okay. And she was one of the sites that we actually interviewed. So we feel very confident that we're going to be able to roll these videos out to all the pediatric rheumatology centers across the country.
That's great. I mean, you must be excited what's happening in pediatrics.
We are, very, yes.
And this has been, I mean, I've only been in this space maybe three and a half years, so I notice things that change in those periods, whereas maybe some others have been here longer don't necessarily zero in on those things. But pediatrics is something that I enjoy watching because it's something that I can see kind of right at the start of, getting the importance that it actually deserves. Do we have any questions, Anita, from the audience at all?
Yes. You mentioned about using brace. So someone wanted to know, from a patient standpoint, when should patients consider using a brace?
Right. It depends on the indication, and certainly anyone who's interested that wants to come to my workshop, we're going to show different types of braces and the indications for those braces, or whether you should be bracing. And so I think that the answer I would give to that is see a good therapist. Ideally, they're going to give you a sense of whether the brace is indicated or hands-on physical therapy is indicated, or a combination of two to get you back on your feet.
And finally, a lot of office-based work, people are saying you need sit-stand desks, or there's exercises you can do at the desk that may help. For our audience, can you demonstrate some of those exercises people can do with their hands, because their elbows would be all painful?
Yes, actually, that's a really important question. And what the audience may not know is that my background, before I became a rheumatologist, as I created a lot of the guidelines on healthy active living. And what we really are inferring to there is incidental movement. So even if, and I don't want the camera to miss me, but even if you were to stand and sit several times a day, that incidental motion that you're doing is burning calories and actually increasing your physical activity. If you want to do stretches, if your wrists are giving you trouble, perhaps just doing a little bit of prayer. Both sides might help you. Just take that time out to be able to do so. Extending your elbows and holding it for maybe 10 to 15 seconds. Extending the other side. Trying to touch your shoulders with your fingers. All these things can help you move your joints. But in terms of being physically active, I love it. A stand-up desk is fantastic. Standing rather than sitting the whole day is going to help you in the long run.
Look at the energy here, right? Talking about exercise is just electric. So it's been a pleasure meeting you. I wish you all the best in your future endeavors, and hopefully we cross paths again.
Thanks so much.
Thanks so much.